So the role of a hip is a really broad role. We see people of any age with any issue, and what we do is we see them for 30 minutes, and when we first meet them we spend about 10 minutes asking some questions to get an idea of what their life looks like, and then we spend about 15-20 minutes focusing on what's on top for the person today. And by the time they leave with a plan of things that they can try. So the hip and the health coach work together as a team within the GP practices. We meet up regularly and we discuss whether there are some tricky issues. Sometimes we see the same people for different perspectives. So say for example, we might have somebody who is struggling with pain, but also struggling with accessing WINS or housing or things like that. We can both work together to develop a wraparound service. So the hip and health coach work alongside the GPs and the practice nurses. The hip role is more of a consultant role, so we work with the GPs and we develop plans together. So if I see somebody and we come up with a plan, I will then tell a GP what the plan is so that we are all on the same page and providing a really robust wraparound service, taking into account physical health, mental health and social health. So the journey of care for the patient will look different for a lot of people, and it will depend on how the referral comes to us. Because there's no such thing as a wrong referral, that means a patient can self-refer directly to the hip. It also means that the receptionist can refer directly, or the pharmacist, or anybody with concerns. So if somebody would come directly to us, the pathway of care would be see somebody raise a concern, appointment straight with us, and then we just focus on what's on top for that person today. If somebody comes via a clinician, so a GP or a nurse at the practice, what would happen is you'd see the clinician first, then the hip will get a warm handover, and then usually on the same day, the hip will be able to see that person to develop a plan. So the warm handover process is when a doctor or a nurse sees a patient, and then they will come and knock on the hip's door and actually hand over what's happening in that moment. Yeah, and they will also talk about the things, the doctor or the nurse will talk about what they want to focus on in that session, so that we can have care that is purposefully focused on a specific issue.